Good day. My name is Kailit Phua. I'm a retired professor of public health. I used to teach at Monash University School of Medicine and Health Sciences in Malaysia. The title of today's lecture is Social Class and Health. Some biographical details. Lecture objectives. First, I'll start with the definition of social class, also called socioeconomic status or SES. Then I'll move on to how the health of individuals is measured, then how the health of population groups is measured. We'll move on to social determinants of health, then to the social gradient in health. What are some possible reasons for the social gradient in health? And finally, some findings from research on social class and health. What is meant by the term social class? In the view of sociologists, we classify people or we place a person's location in the system of stratification, right? Stratification meaning differences in wealth. Some people are rich, some people are poor, some people are very wealthy, right? Some people are very poor. Social prestige, how much esteem some person gets, commonly because of the occupation they are in. All right, so certain occupations have high prestige, for example, being a medical doctor, right? While other occupations, which although very important for health, such as sanitation workers, generally are low in prestige. Differences in power, right? Some people are very powerful, very influential, while others are not. So social class is usually determined or measured based on the occupation of the person and the income they earn per month or per year. As mentioned earlier, social class is sometimes also called SES, or socio-economic status, and this is especially true when educational attainment is also taken into account. That is how much the person has achieved in terms of educational credentials, right? Whether the person is a primary school graduate or a lower secondary or junior high school graduate, or the person has finished high school or secondary school, whether the person is educated to the level of a bachelor's degree or master's degree, or actually has a PhD, right? Or other professional credentials. Okay, measurement of individual health, right? Are there any impairments or abnormalities in functioning of a person's body, right? Either physical or mental. Physical health, example, you measure in terms of blood pressure, right? So ideally our blood pressure should be 120 over 80, right? 120 is systolic blood pressure and 80 is diastolic blood pressure. Our blood chemistry, is it abnormal, right? Or aspects of blood chemistry, are they within what is generally regarded as a normal range? How are our various organ systems functioning? Example, is our liver functioning normally, right? Or are our kidneys functioning normally? Mental health, is a person afflicted by learning disability? Is the person suffering from certain undesirable psychological conditions, right? These are sometimes difficult to determine, right? And then, is a person addicted to things such as gambling addiction? Measurement of population health. The health of population can be measured through the infant mortality rate, right? Infant mortality rate. The infant mortality rate is the deaths of babies under 1 year old per 1,000 live births, right? Of 1,000 babies born alive, how many die before the age of 1 year old, right? So the infant mortality rate can range from 4 per 1,000 live births to as high as 250 per 1,000 live births, or 300 per 1,000 live births, depending on the country which we are considering. The infant mortality rate is made up of the neonatal mortality rate plus the post-neonatal mortality rate. Neonatal mortality rate means deaths of infants under 28 days of age, right? And the post-neonatal is beyond that, okay? So neonatal plus post-neonatal mortality rate. What is the child mortality rate? What is the maternal mortality rate? Meaning pregnancy and childbirth related deaths. What is the life expectancy at birth? And what are the morbidity rates for various diseases, sickness rates? Okay, these are the social determinants of health. Various things can affect health. So, for example, ethnicity, the ethnic group a person comes from, the gender of the person, whether the person is a male or a female. This can give rise to discrimination, racism, sexism, etc. And this can affect the health of individuals. For example, racism, discrimination, sexism can give rise to mental stress sometimes through harassment, sometimes through unpleasant social interactions. Educational attainment can also be considered a social determinant of health. We know that people who are better educated tend to have better health, right? Occupation of a person, the income of a person, right? Occupation can also link to physical work conditions. Some jobs are simply force the worker to work in relatively unsafe conditions. So you have the 3D jobs, the dirty jobs, the degrading jobs, and the dangerous jobs, right? Occupation can give rise to job stress. For example, in Japan, there's a term for death because of overwork. It's called karoshi. Job insecurity, right? Experiencing uncertainty or distress because you may lose a job anytime, right? Or your job is insecure. That can also result in mental stress, which affects health. Housing quality can affect health. For example, poor quality building materials, asbestos, right? Fibers in the air, right? No proper supply of clean water, poor sanitation. This can also result in higher risk of illness for occupants of those low quality housing. The social welfare system of a country can also shield a person against lack of money, right? And protect against poorer health. Okay, this is the social gradient in health. This means that, quote, the lower the social class position, the poorer the health of the individual, unquote, right? Poor health is revealed in low birth weight of babies, right? Babies born with low birth weight, so higher risk of of infant mortality, frequent acute illness, people who suffer from disability, they have poor health, and people who suffer from chronic or degenerative illnesses such as diabetes, right, or various forms of arthritis, or Parkinson's disease or Alzheimer's disease. So these are also people who have poor health. And all this can result in earlier death. Here are some possible reasons for the social gradient in health. First of all, is it possible that the perceived observation that people from lower classes tend to have poorer health? Can this due simply to measurement problems? So that is statistical artifact. So the claim is that certain quarters is that the social gradient actually does not exist, but is due to a measurement error. The counter argument is this is incorrect, because wherever countries have reasonably high quality statistics, the association is always present. So it is not a statistical artifact. Another possible explanation is culture of poverty theories. So for example, these proponents of this theory argue that poorer people tend to have worse health because they have some cultural deficiencies, right? For example, inability to defer gratification, meaning they tend to live for the day, they don't plan for tomorrow, they indulge in excessive alcohol drinking, right, and so on. So it's culture of poverty theories. Then number 3, there can be downward mobility. For example, a person has poor health and therefore cannot hold a regular job or cannot hold higher paying jobs. So they tend to fall into a lower social class or lower socio-economic status, as low SES. So this is poor health resulting in downward mobility. Then there are also material deprivation theories. That is, lower class people have poorer health because they have they earn incomes which are low, right? And because you have low income, you cannot afford to have to buy nutritious food. You live in slum housing, right? You live in more high crime areas of the city, right? Etc. Right? So material deprivation theories. Therefore, low social class position affects health. So low SES results in poor health, whereas this one is poor health for the individual leads to downward mobility. This one is low SES eventually results in poor health. Another possible explanation is unhealthy behavior or lifestyles of lower class people. We know that lower class people tend to smoke at higher rates, right? So they may possibility that they may drink alcohol at higher rates. They are less aware of healthy lifestyles. Their nutritional patterns may be poorer, and so on. Here are some findings from research between on the association of low social class and poorer health. Sir Michael Marmot, who is a medical doctor as well as a public health researcher at UCL, University College London, his studies on the social gradient in health has been called the Whitehall studies. Whitehall referring to the British Civil Service, right? The Whitehall Road in London, which is where a lot of government buildings in London are located. That's why it's called the Whitehall studies of civil servants. The research subjects were British civil servants. Note that none of them are poor because they're all employed as civil servants, but they come from various grades, from the lowest grades to the highest grades. And the finding is there. The finding that lower grade civil servants tend to have poorer health as compared to higher grade civil servants. So Michael Marmot and his team concluded that position in the civil service hierarchy ultimately affects health, whereas because of factors such as stress, all right, such as perception, such and differentials in power, in prestige, and so on. So all this can affect people psychologically and eventually affect their health. This is the end of the lecture. Thank you.